If you're a past attendee, you know we like to begin with some presentation on anatomy. And Mitch has done this for several years with his dissections. But since he can't be here, we turn to our friend Paige Poss, and she's going to handle this presentation on comparative anatomy. And joining her after this will be Stuart Muir, who will lend his expertise that he's gained as a farrier at Root and Riddle Equine Hospital in Lexington, Kentucky. So let's welcome Paige to launch the 2018 International Hoof-Care Summit.
I am so excited to be here. This is such an honor. And Stuart and I wanted to apologize to those who really wanted to see a live dissection. We kind of chickened out and thought that we could convey much better information by showing some of my anatomy pictures and some of the anatomy pictures that Stuart has and other stuff on foals. We felt like we could control the information a little better. Sometimes when you're working on a cadaver foot, you don't really know what chocolate you're going to get out of that box of chocolates. So we thought we could control things better. I'm going to show a bunch of my anatomy photos, and I'm going to share with you my fascination of the soft tissues inside the foot, because those are the ones that we probably know the least about. And I'm such a geek, I spend hours taking these things apart and taking pictures because I'm a hands-on learner. I'm a visual learner, and I have a feeling most people in this room learn a lot like I do. So I hope to share with you pictures that get you thinking. And if you think I've got the answers, misery loves company. I'm going to show you things that might get you thinking and not answer your questions, but actually challenge you to, I don't know, think differently. So I'm going to start out with foal to maturity. Well, I don't work on that many foals and don't get that many cadaver legs for foals. So most of my stuff is going to be about the mature horses and how we manage them. So I wanted to start out with Wolff's Law. And hold on, I'm playing around with something. Joe, can you show me how to use that little pointer? I don't need it yet. But Wolff's Law is basically saying that the bone is going to react to its environment. Oh, thank you. And this is my take on it. Load changes everything. That constant pressure looks like it leads to bone loss. It almost like starves the bone, puts too much pressure on it. But pull and concussion, like working out, leads to bone growth. Of course, these are super simple terms, but that's how I think. It's not technically bone growth and all, but the soft tissues that I'm going to spend the most time with today are going to be the different coriums that grow the hoof, and then the cartilages. In the coriums, there are, some people think there's 5, some 6. I don't, without histology and really being able to go over it, I'm not sure that I can tell you if there's 5 or 6. This image is where it shows 3 of the coriums. This area right here is the papillae that are growing the periopal. This is what is covering from the hairline over the top of the hoof wall. These papillae and the coronary papillae are growing the bulk of the outer hoof wall. This is the hoof wall you work with the most. The inner hoof wall, the unpigmented portion, grows primarily from the lamina. Of course, it's not that black and white, but this is simple enough to get us through this lecture in understanding. As you come around and look at the bottom of the foot, look at these long papillae are the ones that are growing the hoof wall, makes the turn, and then grows on the bar. And this is the pigmented part of the bar, and the unpigmented is growing from the lamina here. And you've got your terminal lamina growing your white line of your bar up here. You can see these tiny little papillae are your periopal or heel bulb corium, and it wraps around and goes into the frog. And here's another picture just showing the papillae growing the sole, and you can clearly see the ones on the frog. So that's enough of the basics. Let me go in and give you my simplistic analogy. I think of the coriums as like a sock that's attached to your skin and toenails, but it's growing your shoe. And everything's going to work fine. The sock's going to stay in place and there's not going to be any problems as long as the shoe is not getting any pull on it or any twist on it or anything like that. Each part of the sock is going to grow a separate part of the shoe. And to show that, this is one of my favorite dissections. I learned so much being a geek in my own shop and spending hours taking the coriums off, peeling them, until I realized that the coronary corium, the periaplytic, and all around the heel bulb is only on soft tissue. It's on the extensor tendon, your ligament, and your collateral cartilages. What that means is when I peeled that off, you could see that it was attached with a fascial connection. Well, fascia moves. That's what's around our muscles and everything else. This was a light bulb moment for me, and I realized that that's why you have coronary bands and everything else that can bulge. You can have shifts. You can have your sheared heels. And a lot of times that is these coriums shifting over this soft tissue. It's not attached to bone. The other thing, taking this back to foal to maturity, babies have just this little seed of a coffin bone, and Stuart has an awesome picture of a baby, and literally you only see a little bit of bone and everything else is cartilage up until you get into the pastern. And if you think about it, proportionally, they have so much more soft tissue. So it seems like these feet could really get out of control quicker. Luckily, they don't weigh as much, so the forces aren't going to drag your hoof capsule out. And here, later I'm going to show in detail how little of this is connection to the bone. So the hoof wall is only going to be connected at the front of the hoof and on the sole where the coffin bone is. And here's the sock. I've pulled it off. Didn't do a very good job with the frog corium, but I just wanted you to see how it really is just a thin layer, and each section of this is growing a different part of the hoof. Going back to that slide, so here is where this hoof was attached to the lamina or the coffin bone. And look at how balanced that still looks. The coronary band on the bottom edge is still balanced. But the excess length in these toe quarters was translated up to the coronary band. It was able to slide a little bit. When you get to the bony attachment, I think you run into more problems. Think about it. If it was the sock was attached to your toenails, there would be a lot different pull than if it was attached to your skin. So here you've got a nice alignment of the coffin bone, the wall, and the lamina in there. Doesn't appear to be any stressors. But on this foot, even though there's not a dish in the wall, look at how the lamina is exhibiting pull on it with the difference in width from top to bottom. So that led me to think about another simple idea that maybe pull encourages bone to grow. That as the lamina pull on the wall, will that start giving you your ski tip? You'll see it a lot in rotated horses and things. And I just threw this one in because it has a nice ski tip on it, and it looks like there would be some pull there, versus this horse who has distal descent, but because he was a clubby-footed horse, he didn't seem to have any pull on the front of the coffin bone. This is just showing how the foot in a normal isn't sunk down in the hoof capsule, but this guy had some distal descent. But here is what the bone looked like. You have bone loss at the bottom of the coffin bone. You don't have that typical ski tip you see on rotated feet. So there's not much pull, so no real ski tip there. This is images of that same foot you were looking at. See the extreme pressure that looks like it's on the sole there? This is the region I cut the sole so that you could see the sole corium had actually slipped or pulled up over the edge of the coffin bone. This was almost 3/8 of an inch higher than the front of the coffin bone, except for it had eroded, and the lamina were up higher. So that kind of goes back to my idea or just reaffirming in my mind that pressure can lead to bone loss. When I looked at the inside of this sole, look at the impression that's being made in there. And I'm seeing this on a lot of feet, that you can pull off the sole and you can often see what appears to be under more pressure than other portions. I also wanted to point out these white marks that I'm seeing there. That was the inner hoof wall or the primary epidermal lamina. I sent this particular picture to Dr. Bowker asking, what are those? I see them periodically. And he told me they are where the primary epidermal lamina or your insensitive lamina have fused. And he said that he sees them kind of randomly. They aren't alarming to him. But when you start seeing more of them and they start getting to be larger areas, that he thinks of it as like a localized laminitis. Well, that led to this other dissection pictures that I put together. Just looking at a common toe crack. I worked for a long time in Virginia where it was more wet, and I was queen of the flared, flat-footed, no-wall thoroughbreds. So anytime I got a new horse that had this much hoof, I didn't care if it had a crack. I was happy I had something to work with. But I finally, after taking apart a lot of feet, I decided to concentrate on what's behind this crack. Because I'm not concerned about it. Rarely is a horse with a crack like that lame. So I work on them, but I don't stress about them. But when I pulled this hoof off carefully, I was really surprised at the detail I got. Look at how the sole corium has changed, and look at the inner hoof wall. Those white regions were much wider and much more invasive than I had realized. I have some images in a new book that's at my booth that shows more of this in detail. But when I went to the next, this is another foot, just a few months later that I took apart, and I went ahead and boiled the bone out to see, and look, you have the thickening of those inner lamina, the insensitive lamina, and those are hard. And they have pressed on the bone, and we, again, have got bone loss behind these cracks. Well, that explains why if You work on these horses, a lot of times you can get the crack grown out, but if they go 1 day too long between shoeings or trimmings, all of a sudden these things appear back. I think what's happened is your outer hoof wall is like putting a brand new piece of sheetrock on a rotten stud. So you can make it, it's like a pretty veneer, but I think the minute it has pressure on it, the tissue behind it is damaged. So this is why these things keep haunting a lot of us. So this is going back to the sock analogy again, where as long as you have your foot in there and no bone loss, you're good to go. All those tissues have a place. They stay organized. They stay where they're supposed to. But as soon as you lose part of the bone, what's going to happen to those tissues? Are you going to end up with disorganized tissue? Are you going to end up with, now, where's that sole that used to be on the bottom? It's fighting with space and for where the lamina were. So here's a relatively healthy coffin bone, and then this one has some significant bone loss. Honestly, I think that's what's going on with a lot of these lamellar wedges. You've got more bone loss back there. Unless you get a skyline view, a lot of times you don't realize how much bone loss you've got. So you have all these tissues just fighting for each other. You have your white line being produced still, but it's kind of randomly being produced. You've got sole tissue mixing with inner hoof wall. And then I'm going to start kind of going back to that idea of pull causing the bone to change too. So this is a 2-month-old foot. And notice the symmetry. This is a 1-year-old. And look at how it's starting to change here. I have it marked better. Oh, that's just the beginning. I am now going to talk about the collateral cartilages, and then we'll go back to the bone growth. So here I dissected out the short pastern and emphasized the lateral cartilage or collateral cartilage. So you can see how much of the foot is actually a cartilage. And here I've done the same thing. This is looking on the inside. So this is where your coffin joint would be. Your navicular bone would be sitting here. And that is your deep digital flexor tendon. And here I've taken my knife and I'm just scoring around the edge of the coffin bone and removing that. So now I'm going to go back to the baby foot and show you the 2-month-old is symmetrical. There is no bone behind the coffin joint. So this is where your short pastern would sit. Your navicular bone would be back here. But in this 1-year-old, you're starting to get calcification of your lateral cartilage. Think it's normal, but it's going to be pressures and all. And more pictures like this are helping me piece together how are these things growing and changing. So this was a yearling. This is a horse that's not a baby, probably fairly young, but he's still pretty symmetrical. It's almost the same length as the medial side looks, and I'm thinking it's medial on these. I've got these actual bones in my booth for anybody who wants to come put your hands on them. But I've marked the edge of my coffin joint to help emphasize, look at the difference in this palmar process versus this one. On this medial side, that guy looks like he's got a lot of pressure and he started having some bone loss here. But here you've got a lateral flare that is starting to create, your cartilages are starting to calcify, you've got the bone is wanting to build more bone on the outside. And by contrast, this foot has started calcifying internally. That's a foot that's probably really contracted and the horse is loading. So many of these load issues are really coming from above. It's not all about what we're doing. Took the same 4 bones and threw in the baby one just to show, again, the movement medial and laterally on how these have grown. I've just marked where the coffin joint is. So a lot of times when you see a lot of changes and it looks like a lot of damage within feet, it's very discouraging. You start just worrying that, you can't do anything without having to deal with a problem. But I threw in pictures of this particular horse. This was a horse given to my friend as a companion horse. She was started, went lame, she was 5 years old. So my friend brought her home, and because she had such a small environment, she started ponying the mare after she'd been doing her feet for a little while. She started ponying the mare, and the mare got happier and happier and happier, and she finally was like, I'm tired of ponying her. Why don't I try riding her? That was 7 years ago. And the mare, because she's been able to manage her, she does the feet herself, and has found the happy spot, she has taken this horse, and she rides her 5 or 6 days a week, anywhere from an hour to 2 hours a day. And this horse is happy. Is she 100% sound? I don't know. It looks weird when she paces. She's a Peruvian Paso, and when she gaits, it looks weird. But after 7 years, it's amazing how little arthritis she has in that terrible knee, but it is interesting how much the lateral cartilage has calcified with the side bone. That's the side that she lands really, really heavily on. So images like this and seeing how that cartilage looks is helping me piece together how these forces and all are affecting these soft tissues. And that's her happy place. This is where the mare is happiest. So she ends up having, because she works on the horse herself, she's able to reset her the minute the mare starts getting reluctant to go to the right. So I just wanted to touch base that, or emphasize that these soft tissues that we don't get to see that much are playing a big role in how we handle these horses. And her philosophy, Ruth is not a professional at all. She just shoes her own horses. But her idea is just to keep the foot tight around all these soft tissues, and it seems to be working for this horse. I have no idea how much time I have left. I'm done. So I would love to answer any questions that people have. Yes?
Obviously, the Foal were one shot. What about the older Foal?
Sadly, I don't get a whole lot of history on these. That is the problem I would actually love and ask anybody in this room. I've now moved and am concentrating more on the anatomy. If people ever get a chance to get a cadaver foot that they have history on, if they are interested in sending it to me, I think it would add to the benefit of everybody if we had more of those, and I'm willing to do the work if people would occasionally freeze them and send them to me. Because I don't know that. What other questions? Fine. Anything else? Yes.
correspond with a lack of blood flow?
Yes, I think that the corium is often crimped, and you don't have that much blood in the coriums to begin with. And I think as soon as you crimp it, there's another element that I, in theory, think could be part of it too. You've got your compression and lack of blood flow, but you also have now, what has happened to those papillae that were happy and standing up? Are they being mangled and compressed and losing their orientation? So, yes?
Don't you think that, actually, what I'm thinking of foals that are in the hot houses, what we call them, where they're not out enough to exercise, whatnot, that actually sets up some of those feet to disintegrate, if you want to use that term, bone loss, a lot faster.
I would think so. It seemed like the more expensive the horse, the more it was wrapped in bubble wrap, the more fragile it was and the worse the feet were. Anything else? Come on, guys. Ah, there's somebody back there.
So since we're talking about foals and maturing with soft tissue structures, with these foals that are kind of not exactly allowed to be free roaming or not actually put to test, and you're talking about soft tissues ossifying or at least strengthening, especially the collateral cartilage with pressure, do you think that these foals that are kind of kept up more are more less likely to develop a stronger collateral cartilage to hold up the back of the foot?
I do. And I feel like that leads to your underrun heels. I think it leads to, they're thinner. There are huge differences, and I think it is breed does play a part. I used to think that well-managed thoroughbreds who are out building those would have as good a collateral cartilage as a Connemara. Well, you know, it's not quite. You've got some genetics going for them, but I do think horses, especially that have a tendency to have lighter, weaker structures, the more they are babied, I think the weaker they stay. Of course, I don't have any real research behind that, just other people's and observations. Are we? Ah, there you are. He's getting it.
Hi there. My question was more about when a foal is growing from its tiny little triangle feet to its full size, there's been a bit of a sort of discussion on the fact that the foot rounds out, but the bone is always getting bigger as they're growing. Have you looked into what the process is between weight bearing of the foal on the foot getting bigger compared to a foot out of balance?
I haven't done that many with foal feet. I just occasionally get them. And in my previous life, I worked in science. I was a lab tech and stuff. So many times when you get the one example, you can't really call that research. It's literally observations. And all of this stuff is really observations that I have. And sadly, I don't have enough with that. And how are you going to test it anatomically the way I do, by cutting things up?
Yeah.
I can't say this is what it looked like here, and 2 years later it looked different, because
Have you got
in the lump.
a general idea when foal's feet stop getting larger? As
I
far
think
as
Stuart is going to be able to answer
okay.
more of
We'll
those.
leave that one.
And if not, I'm still putting it on him.
fair enough.
All right, let's give Paige a round of applause.
Thank you.